how to decide whether or not to get an injection. When you're having pain, you often wonder, should I get an injection? And the answer to that is actually a little more complicated than meets the eye. The concern people have is that getting an injection will mask the pain and then put them at risk for re-injuring it or aggravating it further. And while that is a real concern, when you come to therapy, we understand human movement and proper stresses to the body, so we would never put you at risk for injury. However, we have seen clients at home that as soon as they start feeling better, they clean out the entire garage and they then re-injure themselves because they haven't felt that good in months. So the question of whether or not to get an injection is extremely difficult because, yes, you can mask the pain, which is good, but the question is, will that help you move better? We at PhysioPoint believe that if you move better, you will feel better. So feeling better is sometimes the pathway to moving better, so you will then feel better, move better, feel better. But that's not always the case. In fact, the question is, are there other natural means, maybe glucosamine sulfate, maybe turmeric to bring down inflammation, maybe fish oil, maybe omega-3s. The goal would be to do the least invasive and the least pharmaceutical way of getting yourself better first, and then you might want to consider going the injection route. But as far as physical therapy goes, we will never put you at risk for injury because we understand how the body moves, even if that pain happens to be masked. Now, on the flip side of that, if the pain helps guide us to the problem, not the victim is usually what's painful, but if the pain guides us to the culprit, the person or the thing causing the pain, then that abstaining from an injection actually might be useful so that we can get to the root of the problem, which is our guarantee to you, or find somebody who can.